a good guy. Speaking of good guys, we have a good guy in studio from Summit Orthopedic on our AM Minnesota show today. Dr. Clinton Muench has joined us, and of course he is in the Christmas spirit, right?
I am. Good morning, Gordy. Good to see you.
Yeah, it's good to see you.
That was a good song.
That was a good song.
I've never heard that one.
Yeah. Well, you have to put it in your...
Put that on my playlist.
Yeah. On your iPad or
some kind of
whatever
device.
You have. Your phone.
Right, exactly.
We've got all that stuff. In fact, speaking of that, I was looking on your website. Man, oh man, you got a lot of stuff on there. A lot of great tips, holiday baking tips.
Oh, I haven't seen that. Yeah. I was thinking more orthopedic tips, but now we're into baking.
You have dietitian Amy Lewis, I think is her name, has some tips on how you can do your holiday baking of cookies safer or something like that.
Probably tip on that, I think, is less sugar, I would say,
Yeah.
Limit the sugar.
Well, that would make perfect sense. And there's some other tips from her on there, too. Some kind of a breakfast treat that will give you more zip, more willpower or something to refuse some of the treats. I don't know. I didn't really. But that information's up on the website.
Yeah, there's all kinds of stuff on our website. I think there's good information on orthopedic injuries and orthopedic care as well. I think it's a good resource.
But I couldn't get over how many doctors you have.
Yeah, many. I think there are 30 surgeons now, and then there's probably another 20 or 30 non-operative physicians, so it's a big group.
So you can tap into a lot of different areas if you need to.
We can. That's the beauty of our group, is that if you need a subspecialist, we can get you one quickly, and that's been a nice availability for us, as we can get you a hand surgeon if you need that, or a foot surgeon or spine surgeon. Some of the things that are maybe out of our area of expertise, but we know good people that can take good care of you. We can get you in to see them really quickly.
So you don't deal with hands?
I do simple hand stuff, but the more complex stuff, that you need a hand specialist for, I'm happy to send you to somebody that I know that's good.
Yeah. I know your specialties are like knees and shoulders and arthritis, right?
Yeah, hip, knee, and shoulder is the kind of the primary part of my practice, and I'll do some simple hand and maybe some simple foot stuff, and no real spine. So we tend to send our spine stuff to mostly non-operative spine providers in our system, because most of the time people don't need surgery on their back or neck.
Yeah. I was going to touch on that maybe in the next segment, because we don't have a lot of time before our opening market break. But I like the fact that you at least try before going into surgery on the back.
Oh, yeah. Always. Because 90% of people are going to get better without surgery. So that's what I would do.
Now, back in the day, it was always recommended for surgery with backs, right? I'm talking
maybe
20, 30 years ago.
Maybe. And, of course, it depends on the problem. For trauma or something, sometimes that's the only option. But for, a herniated disc or some sciatica, some low back pain, most of the time those things get better without surgery. And so we just need to get you into the right hands. And that's, so come see us and we'll find the right person for you.
So you do certain exercises or something to relieve that, or what?
Yeah, oftentimes physical therapy is the key. That gets you better.
Isn't that something?
Yeah. The body has an amazing ability to heal itself.
It certainly does.
It does.
So we're going to talk some more with Dr. Muench about various topics. Arthritis, of course, is one that's kind of near and dear to my heart, because I have it,
Many people do, yeah.
So you talk about what you know.
Yep, exactly.
And I found it interesting. On your website, it says if I walk 6,000 steps a day, it'll help with my joints.
Yeah, for sure. I think that's good advice. I think, that comes down to the people with arthritis. If they're inactive, they feel worse. If they overdo it, they feel worse.
Yes.
So there's kind of a sweet spot in the middle where if you stay active, your joints will work well and they'll feel well. So, yeah. I think
they're meant to be used, right? The joints.
Exactly. Yep.
They're meant to be used.
They're meant to be used.
Yeah. So you have to kind of, work through the pain, I guess.
Yeah, in some respect, yeah. I mean, we don't want you to sit on the couch or you're going to feel worse. But, we don't want you playing, some kind of pounding activity that makes you pay for it every time. That's probably not the smartest thing to do either. So some activity in between that's low impact is good for them.
Speaking of easy to remember, Dr. Clinton Muench is with us. That's an easy name to remember. Dr. Muench is from Summit Orthopedic. Now, a year ago at this time, you weren't Summit, right?
That's correct. Yeah, January 1st, 2017 is when we started officially.
So has it been a good year?
It has been, yeah. Yeah, it's been a very good year.
You're happy with the move?
Yeah. It's change is always difficult for everybody, and I knew there were going to be some changes, but you adapt and you move on, and things are good.
You're also in a different facility than you were a year ago.
We moved across town, which is really quite different. We were on the other side of town for a long time. It's hard to get my truck to turn the other direction to go on this side of town, but yeah, it's been good.
You found yourself once in a while going to the other place?
Yeah, I did. Old habits. You think, oh my gosh, I got to go the other way. Yeah, now it's habit. I don't have to think about it anymore.
Right. So what is your address?
We're on Lyndale Avenue, right next to the garden center.
Okay. Well, that's good enough. People in town, I don't know if they don't go into exact addresses.
No.
How small town living is.
Exactly. Yeah.
Turn by the oak tree,
Exactly.
The such and such station.
Yep.
So right by the garden center.
Yeah, right next to the garden center. Yep. There's a business there, and we're on the end.
Lyndale Avenue is off Highway 21.
Correct.
I'm trying to think. You don't have a direct access off 21.
We do if you're going toward 35.
Okay. All right.
Yep.
So again, Summit Orthopedic is the name of the facility. And we were talking about arthritis before the break. I thought we might resume that conversation because I did see on your website where it said, and I didn't get a chance to read the article, that hot and cold, heat and cold, helps with arthritis.
Yeah, I think, for that it's kind of trial and error to figure out what feels best for you. I think there's no real science to guide us there. It's not like an acute injury where you wouldn't want to put heat on an acute injury. You'll make it swell more, make it bleed more, make it more painful. So with arthritis, it's dealer's choice, either way, either heat or cold, whichever you think makes it feel better.
Well, I will say, when I strained my meniscus and I had to do some rehab on it, boy, ice was such a godsend.
Yeah, it helps a lot, especially, like you said, when you're after you see the therapist and they've worked you over, then throw an ice pack on there, and that tends to help.
I wore the ice pack quite often.
I bet. Yeah,
because it really was comforting, kept the swelling down, obviously.
Yep, perfect.
I mean, that's the reason you do the ice, right?
It is, yep, exactly.
And then on the heat side of things, do we know why it helps? Because I was telling you during the market update that I have a heated steering wheel and heated seats in my Explorer, and man, I swear that helps me with my arthritis.
Yeah, I think, for the heat dilates blood vessels, increases blood flow, so kind of gets things moving, loosened up. And so our therapists oftentimes will use heat before they treat you to kind of get things loosened up and moving, and then, bend your knee or move your shoulder or whatever it is they're working on, and then afterwards, put the ice pack on you to get things to kind of calm down. So, yeah, the heat kind of dilates blood vessels, increases blood flow.
So it's a good recommendation for all of us suffering from arthritis.
It is. I try one or try both and see which one works best for you.
All right. Sounds good. So what do you see most of in your practice? Is it arthritis?
Yeah, I would say, it's mostly traumatic injury, and then kind of degenerative conditions like rotator cuff tear. Then that can be either. It can be traumatic or degenerative. And then tons of arthritis. So hip, knee, shoulder arthritis. Yeah, really, really common.
Shoulder arthritis.
Hip, knee, and shoulder. Yep.
Yeah.
Yep.
I think I've got it in all three of those.
That could be. Sounds like
isn't that a bummer? That's the trifecta.
Right, exactly.
Yeah. Well, I was telling you during the break, my dad had arthritis head to toe. Mom claimed she never did, but she had some crooked fingers.
Yeah.
That doesn't necessarily mean arthritis, huh?
Oftentimes it does.
That's what I thought.
It's not always painful, in the fingers. It can be kind of stiff in the morning, and you can lose some range of motion. But, yeah, those lumpy, bumpy, crooked fingers are arthritis. Yeah. They look pretty good.
I was going to see if they were lumpy and crumpy.
It's not very good for radio, is it, when we're
one of them
looking at your fingers?
That one I dislocated in basketball when I was a junior in high school. Never healed right.
Yeah.
See how the knuckle is bigger than it's supposed to be?
Yeah, that's pretty common after that kind of injury.
And really?
Mm-hmm.
You mean your whole life you have a swollen knuckle?
Yep. Usually works well. Usually have good motion. It works well.
Yeah, there's nothing wrong with the motion.
Thicker than it used to be. Yep.
Why is that?
Just the soft tissue scarring,
Could you fix that?
No. Nope. Just increase your ring size,
I'm
Otherwise
stuck with a big finger my whole life.
You are, yeah. Size 10 ring.
even though I have little fingers.
Right.
Little hands. Yes. Uh-oh. It says our startup disk is almost full. What does that mean?
That means you're running out of hard drive space, I think.
on this computer that's taping the show. It's almost full, our hard disks. Yeah, I hope we make it through this show.
I hope so, too.
Yeah. So, with the holidays coming up...
Busy time of year.
It is a busy time of year. So, will that make you less busy?
No. This time of year is historically always really busy. You know, the insurance plans all have deductibles that kind of go through the end of the year, and people, you know, have had a knee problem that's been nagging them the whole year. Now their deductible or their maximum out of pocket has been met, and so they finally want to take care of it. So every day in the office we hear, "Oh, can I get this in before the end of the year? Can I do this before the end of the year?" So really busy time of the year usually.
Yeah, and you work well with those insurance companies.
Oh yeah,
you have to.
We do. We take all major insurances.
I mean, that's how it works.
That is how it works. Yep.
So, any recommendations about? I see you have free knee, hip, neck, and back assessments, online assessments on your website.
Well, you know more about our website than I do, interestingly. And then the information on there is usually really good, and it's always updated and changing, so it's hard to keep up. Yeah. But that wouldn't surprise me. I think, you know, the main kind of take home is if you have a hip, knee, or shoulder problem, just have it looked at by us. You know, we can figure out what it is that's causing your problem, and we can come up with a treatment plan that's most oftentimes not surgical to make you better. So all you got to do is come in and have us evaluate it.
And that's the key thing. That
is the key thing. And you and I off air kind of talked about access, and all you have to do is call us or stop by, and we'll get you in. That is not a problem. We're going to be able to find a spot for you to be seen. Monday through Friday during business hours. In Faribault here, we don't have after-hours access. We have that in our Egan location. That's kind of our closest after-hours access.
It's called Ortho Quick Care.
It's called Ortho Quick, exactly. Yep.
Or Ortho Quick Walk-In Care. I think is what it's called.
Yep. So they can see you for an acute problem after hours or on the weekends, and we can do the same during business hours. You know, you don't have to have an appointment. You can call us, and we'll get you in same day.
And your Egan location's, 30 minutes away? 35 minutes?
Yeah, that's about right. Exactly.
So even that, if you could go there.
You could. Yep. There's always somebody available to see you.
If you feel that it's an emergency and you need to see a doctor right away.
Yep.
But you were telling me same day. I can get in same day.
Yeah.
I fall on the ice this morning. I can be in before the end of the day.
Yeah. There's always somebody in our office available to see you. Might not be me. I'm not there all day, every day, but there's always someone.
Yeah. Well, that's good to know.
Yeah. You just have to pick up the phone.
Hear that, folks? In an emergency, they're the people to go to. And I was telling you off the air during our market update, if I had a back issue, I probably would go see one of you folks before I go see a medical physician, because they're just going to give you some Tylenol and right?
I mean, I think you're always better off for any orthopedic problem. Just come to us first. You know, we can figure out what your insurance needs for us to be covered under your plan, and we can come up with an accurate diagnosis and a comprehensive treatment plan to get you better.
I think we just ran out of hard disk. We ran out of space. Just kicked us off.
Uh-oh.
We're still on the radio, though.
Oh, that's good. I was worried that everything was going to crash.
Nope, and we're still online.
Oh, good.
KDHLradio.com. But
no longer recording.
No longer. Well, it looks like it's recording. We'll see, I guess.
Yep.
When we're done. So Dr. Clinton Muench is with us this morning. Shoulders. You see lots of farmers and people that do a lot of physical work have shoulder issues.
Yeah. Oh, for sure. Yep. But then also, people that have more of a sedentary job or sedentary lifestyle get shoulder trouble too. Really common problem that we see in our office is shoulder pain.
But they're not using their shoulders.
No, but there are degenerative conditions in the shoulder that just happen without overuse or without injury. And I would say that's probably the most common shoulder
just part of the aging process?
Yeah,
is that what you're saying?
Yeah. I just woke up one day and my shoulder was sore kind of thing. That's a really common complaint.
So they might have slept wrong.
Maybe, yep. And, it's most often rotator cuff bursitis or rotator cuff tendonitis. And again, that's usually a non-operative fix to try to make that better.
I have to tell you, the best thing I ever did, a couple years ago, I purchased a bed that goes up, the head, and goes up the legs,
Yeah. You like that?
I don't roll at all anymore. I sleep calm. I used to roll all over the place.
Now that your bed is
Now that I'm elevated head, and I read where you should keep your feet above your head, so I do when I elevate my bed. The feet are above my head. If this makes any sense, that's what I read.
Just trying to picture it in my mind.
Yeah, but
sounds uncomfortable.
I don't roll at all. Well, you can when you're
right.
When you're situated that way.
Yeah.
It sounds uncomfortable, but it's not.
It does. Wow. Good night's sleep that makes everything better.
Yes, for sure. Now, I don't sleep a lot at one time. I have to wake up every couple hours to go to the bathroom.
Yeah.
You know, as you get older, that happens.
Yep, pretty common.
But when I do sleep, man, I am sound.
That's good.
I don't remember my dreams, though.
I don't either. It's weird, isn't it?
I don't know if that's a good thing or a bad thing.
I don't either.
But I know everybody dreams.
Yep, that's what I hear.
I just don't remember them. So we talked a little bit about shoulders, the knee.
Yep.
That's another one that can
really
just be an age issue.
Yeah. Really common for traumatic injuries like you were describing, slip and fall on the ice, or twist your knee, tear your meniscus, sprain your MCL, or playing sports and tear your ACL. Those are all really common injuries. But then also degenerative conditions like arthritis are really common in the knee joint, and we see that every day as well.
It seems like there are more and more torn ACLs in sports.
I agree. Yeah, I agree, and we're not sure why that is. You know, whether it's kids are bigger, faster, stronger, or whether it's the surface, whether it's the shoes, whether it's poor training for ACL prevention.
It's probably a combination of all those things.
Exactly. It's just like cancer, diabetes, or whatever else. It's multifactorial.
So I can do something exercise-wise to strengthen my knee so it doesn't tear as easily?
Yeah, we can. There are ACL injury prevention programs that have been proven to reduce the risk of ACL tear.
This isn't wearing a brace.
No. It's more like learning how to take off in a 2-footed jump, how to land from a jump safely. You know, we find that people that are more prone to ACL injury land with their knees kind of collapsing toward each other when they try to land from a jump, and that's a dangerous position.
You should keep them straight, you're saying.
Not straight, but centered under your hip and over the ankle. So not collapsing in toward each other like a knock-kneed position. So just things like that we can...
Yeah, I meant facing straight. The knees are facing straight. Over your feet, facing straight.
Yeah, exactly.
So you're coming straight down.
Yep.
There was a volleyball player, I won't say who she was. You may even know who she was.
Mm-hmm.
For one of our high schools here locally.
Yep.
They used to always land on one leg.
Wow.
Well, eventually that knee did give out on her.
Yeah.
I always thought when I watched her play that, you should probably learn how to land on both legs.
Yeah, I think it's important, and that's kind of the population that we're seeing that real high incidence of ACL tear is our female athletes, especially volleyball, basketball, soccer, and I think you can, it's been shown in research that you can reduce that risk with some ACL prevention training. So,
like a certain way to warm up or something?
Yeah, that's a huge part of it. But then, like I said, just learning how to land from a jump on two legs safely.
Yeah. Warming up is something, when I was a kid...
Nobody did it.
Well, very rare.
Yeah. Very
few athletes did. There were some that did, but we weren't taught to do it. We weren't told to do it.
No, and I think we now know it's important. A dynamic warm-up before sports participation is really important. So...
And that's why you see that all the time now with the professional athletes.
Yeah, yep.
Exactly. They're out there hours before the game.
They are, yep.
Warming up.
Exactly.
Getting those joints ready for, let's use football as an example, for the violence of that game.
Right, exactly. Hopefully that, reduces the risk of injury. I think the sprain-strain kind of injuries are reduced by a good, dynamic warm-up. And then, equally important then after that activity is some static stretching and cool down, for a period of time. I think that's really important as well.
So if I wanted to find out if there's an issue with my knees, I mean, they've been giving me pain most of my life.
Yep.
I've kind of lived with it. Since I was in high school, I had some knee issues.
Yep.
I mean, I just figure I'm going to have knee pain my whole life.
Sure.
But if I wanted to go in and see if there's specifically an issue that could alleviate that pain, do you guys just take a look at it?
Yeah. So we would take a careful history and do an accurate, careful physical exam, probably get some x-rays, and then most of the time, probably 80% of the time, you can make the diagnosis just with those three things and then come up with a treatment plan. Sometimes we need an MRI, not always, but yeah, I think that's what we're here for.
Okay.
That's what we're expert in.
Now, is that assessment, not the x-rays and the MRI and stuff, but is the assessment itself free?
No.
Okay.
That would be billed to
that's
your
the
insurance.
Online tool.
Exactly.
Okay.
Yep. Yep.
I wanted to clarify that.
Yeah. Yeah.
So the online tool obviously is free,
Yeah.
where you can do a knee, hip, back, neck assessment.
Mm-hmm. Perfect. But yeah, the face-to-face time and x-rays would be billed to your insurance.
Might be worth it, though.
Usually is.
You know, and I like the idea that you don't automatically throw me under the knife.
Yeah, for sure. I mean, that, for some conditions we see, that is the best option, and that gets bumped quickly to the top of the list. But the vast majority of the things we see, non-operative treatment works really well.
And that's what your priority is.
I just want people to get better, and we do kind of a shared decision-making plan. So I usually tell people, these are your options. What do you think works best for you? And let's try that. And, often, nobody wants to have surgery. So the vast majority of the time people say, oh, I don't want to do surgery. That'd be a last resort. Let's, what do you have for me that's not surgical? So other people say, I'm not interested in doing all that non-operative stuff, and I just want you to fix it. So, but, most of the time people don't want surgery.
Are most of these same-day, I don't go under type of surgeries?
Oftentimes, yeah. Not always. We do a lot of outpatient surgery, yeah. But our joint replacement practice is inpatient right now. The length of stay has decreased a lot, and in some facilities we are doing outpatient joint replacement.
Because you want that joint to start moving right away.
You do, yeah. I mean, the technology has advanced to the point where we can control the pain afterwards way better than we used to. And that has driven down the length of stay and hopefully driven down the cost for everyone and improved comfort and mobility.
It's kind of interesting. I've talked to a lot of people who've had, hip replacements, knee replacements, shoulder replacements, whatever the case might be. And it varies from person to person. Obviously, we all have different pain thresholds.
Yep, for sure.
Some of them say the pain is almost unbearable. Others say no problem.
Yep. It's really variable. Mm-hmm. And interestingly, in the same person, from joint to joint, it's variable. The first knee might have been really, really difficult, and the patient's apprehensive about doing the other knee, and then the other knee is much easier. So I don't know why that is, but there is a lot of variability in perception of pain.
So is the hip more difficult than the knee replacement?
The recovery after hip replacement for the patient is a lot easier, less painful, and no real therapy, and tends to get better pretty quickly. The knee and shoulder surgery, we spend a lot of time in therapy trying to regain motion and strength, just because those joints have more freedom of movement than the hip does.
That's true.
Yeah.
Can I go golfing if I have my hip replaced?
Yeah, if you could golf before. Yeah, we usually about 3 months after the surgery is when after hip replacement or knee replacement, that I tell people they can start to take some easy swings with their golf clubs.
Oh, okay, that's good to know.
Yeah.
And Dr. Clinton Muench is with us from Summit Orthopedic. Do you know what your phone number is out there?
It's 507-334-1601 or summitortho.com.
Summitortho.com. Again, that number is
507-334-1601.
So if you're thinking about, your shoulders hurt or your knees hurt and you haven't ever had an assessment of it, you can do the free online one.
Yep.
The questionnaire thing.
Yep. Or we're local here in town. Just come see us.
And then I'm assuming that the questionnaire will tell you whether or not you should see somebody.
If there's ever any question, I would just come see us. It's just as easy to drive across town and come see us here in Faribault.
So you don't deal with necks?
We see some
simple.
I do some. Yeah, I do some. I mean, I don't do surgery on the spine in any way, but I can get you into the right hands. And again, like I said before, most of the time that's non-operative. So
That's good to know. A friend of mine had several back surgeries.
Yeah.
None of them helped him.
That's too bad.
I mean, seriously.
Yeah.
I think of all the money spent on those back surgeries.
Right.
And it never really helped him.
No, that's too bad. Thankfully, most of the stuff that we do, the hip and knee replacement, shoulder replacement, rotator cuff repair, ACL, the success rate for those, the outcomes for those are really, really good. So, the vast majority of our patients are happy after their experience with those.
This is going to sound like a really bizarre question, but you got to consider the source.
Right, exactly. Right? That's true. Right? Yeah.
If I had a loved one that I wanted to get in to see you, can I purchase a gift certificate of some sort for the holidays to hint give to that loved one?
That'd be nice
to get them into your practice.
I wish we could do that. That'd be nice. Unfortunately, the goods and services, we don't exchange money for the services we provide, right? Where there's a middleman, the insurance company.
Oh yeah.
So we can't.
Do that.
Back
doesn't
in the day,
work at your place.
Take a chicken and some eggs, and for looking at your knee. But not today, simpler times.
That was an idea.
Yeah, it was a really good idea.
You can still encourage them to go, though.
Yeah,
really,
for sure. I mean, I think that's what it comes down to. I've seen you limping all year. Why don't you go have that checked out?
Yeah.
Go to Summit Ortho.
You're always crying in pain and
right. Yep.
Screaming in pain. All right. That concludes today's edition of AM Minnesota. Thanks, Dr. Munch.
Thanks, Gordy.
Always learn something when you come in the studio. Happy holidays to you and the whole staff.
Thank you. Merry Christmas, Happy New Year to you guys, too.
You're in tune to KDHL AM, Faribault, Minnesota. Have a healthy